you talk about where you feel like science is at, do you kind of agree that it's in preliminary stages or somewhere in the middle?
Yeah, I think it's different depending on which risk factors we're talking about. So on the one hand, there's nitrates, there's also pesticides and potential connection to cancer from those. And I mean, I guess when it comes to nitrates, there have been several high quality studies that have suggested that nitrate levels even lower than the current EPA limit have been associated with cancer. So there is evidence out there. Now, in terms of making a bigger proclamation of, this is definitely carcinogenous or possibly, there have traditionally been organizations like the EPA or the World Health Organization that have looked at these issues and, do a really in-depth analysis and, kind of issue statements about what levels are acceptable. And so one of the things we're doing is, it doesn't look like the EPA is going to really be touching on this issue anytime soon, but one of the things we're doing is thinking about how we can pull together a team of scientists to come out with a really clear statement about what level of risk and what limit of nitrate would make sense if you're concerned about cancer in particular. So that's one area that we're looking at, and I guess, yeah. So I think the question really comes down to there's the science aspect of it, and then there's what you do with it. And we're coming from a perspective of a precautionary standpoint where if there's pretty good evidence that nitrates in drinking water are linked to cancer, what are some policy things that we can do that would be protective of the public, even if we don't have absolute certainty about exactly what level of nitrate we should be setting it at? So there's the precautionary principle is something that's been used in a lot of different contexts when it comes to the environment and public health, in terms of saying you can't wait around for absolute certainty in all cases before you start looking into ways of protecting the public. And I feel like that's where we're at when it comes to nitrates in particular. I guess I would also say that in Iowa, there's we've been number 2 in cancer for 3 years in a row, and there's been a lot of discussion about that. And of course, when you talk about environmental risk, it's just one risk among many others. But the proper response to that, I feel, is not to say, well, it's complicated and so we don't know what to do. The proper response is to really dig in and find out what can you get from the science, what additional science is needed, and how can we come up with a really in-depth analysis of that. And so that's been the approach we've been taking with the Iowa Environmental Council, where we're doing a scientific review of what's known currently, and then also advocating for ways of gathering more information, so making sure that our water monitoring network is fully funded and that we're doing everything we can to be collecting as much data as possible, so that we're as informed as possible about what the risks are in different parts of Iowa.
Mm-hmm. So with that precautionary principle, what would be your dream goal? This is what you really want for Iowa. Let's start with nitrate, but you can also cover, your goal for other risk factors with public health that are linked to kind of the environment we have in Iowa right now.
Yeah, I mean, it's, as I said, the exact limit of how many milligrams per liter is currently at 10, but that's because of blue baby syndrome, and so it has nothing to do with cancer risks. So one thing I would want to see is a scientific committee that comes out with a really well-informed, very researched declaration about what they think the proper limit of nitrates should be if we're trying to protect people from cancer in drinking water. And then I think, whatever that limit is, we already know that in Iowa there's just this huge problem of excess nitrates that are coming from excess application of fertilizer and manure being put on fields. And so I think we're already at a point where we should be looking at policies that are going to limit the amount of nitrates that are washing into the rivers. Nitrates nitrogen is helpful for growing crops, but anything that's being washed into the river isn't really helping growing crops. So we should be looking at policies that are basically limiting the amount of nitrates or nitrogen that's getting washed away and getting into our drinking water. So I think there's a number of steps that we could already be taking as a state, including things that Minnesota has already done that would help to limit the amount of nitrates in our drinking water.
Can you talk about some of those things in Minnesota, or what you really see as potential solutions for Iowa? Like, in our given environmental and political climate, what kinds of things would be kind of reasonable to expect if we had enough scientific kind of push as well as a public push?
Yeah, so one thing that Minnesota does is they limit fall application of fertilizer on the fields, and that's something that Iowa doesn't have a policy on, but I think in general that a lot of the fertilizer and manure that gets put on in the fall months gets washed into the rivers and streams, and so doesn't really play that good of a role in terms of growing crops, but does have a big impact on our waterways. And then there's also a lot of things in Iowa where we're just very limited in what information we can have. So the manure management plans for a lot of different confinement operations and areas, they are not digital at the moment. They are just paper management plans. And so if someone wanted to look to see if there's too much manure being put in a particular field from surrounding concentrated animal feeding operations, there's really no good way to even do that, because the plans, the manure management plans are just sitting in a county office, and they're hard to access, and there's no digital way of kind of overlapping them on each other. So I think there are a lot of steps that we could be taking just to get a better sense of where manure application and fertilizer application is happening, and that would set us up to think more about what possible policy approaches would incentivize putting less manure on, less fertilizer on, and also looking into this question of whether regulation might be appropriate in certain cases.
So as you touched on, we have this big public push right now, especially just following the summer. Do you see some of this policy, it sounds like making data more accessible and collecting more data happening soon? Or do you still think this is going to be a few more years of push, and what is, in your opinion, the risk of waiting, like a few years for gradual change, for example?
Yeah, I think I don't see any good reason for waiting on steps that can be taken to gather more information and make sure that we're better informed about the level of chemicals that are in our waterways and where they're coming from. So, every year that you're waiting on doing that, that's many more people who are put at risk. And, if we're talking about nitrates in drinking water and there's a connection to cancer, then that's lots of more people who are getting cancer every year, and some of them passing away. So there's a pretty big cost to waiting. And I guess from my experience, we organized the Central Iowa Waterway Source Assessment here at Harkin Institute and had 600 people attend in person and 3,000 watch online. So there was this big response in Central Iowa, but we also, with Iowa Environmental Council, did these listening sessions around the state. And even in rural areas in Iowa, people are really concerned about the cancer rates and worried about their drinking water. So I feel like we're at a point where there's a lot of energy all across the state where people want to see some kind of change, and transferring that into policies that are directly impacting regulations or incentives, I think, is a trickier thing that might take several years before something happens. But in terms of gathering information, to me, it doesn't make sense for anyone to be able to say, well, we don't want to know more about what the risks are. We don't care what level of nitrates are in our rivers or where it's coming from. So I'm hopeful that the monitoring and data collection could be something that everyone would agree on should be a priority even this year.
do you feel that you kind of work in nutrition wellness, so you're looking at this pretty holistically too, that water concern crowds out any other concerns, or that you'd like more attention to be paid to any other specific environmental or behavioral factors that just haven't gotten that same, like, public, what do you call it, like, gusto, is that the word? Yeah.
Yeah, I mean, I guess, yeah, it's an interesting question. I think I'm coming at it from a little bit of a different perspective, where I think water quality is getting a lot of attention now because a lot of those other things have already been known to be connected to cancer. And so they're, of course, really important, to watch your diet and have a healthy diet, and to avoid smoking and drinking, and to, limit exposure to UV sunlight. So those are things that have all been known for a while. So I think the reason that water is being talked about so much is just because the findings that have been coming out and the fact that it's impacting, having lawn watering bans and having beach closures is something that's really jumps out at people in the public. But I don't think that that means that anyone's diminishing the importance of those other topics. In fact, I would say if you look at, what's coming from the state government and other very powerful, big organizations, they talk quite a lot about these individual risk factors like smoking and your dietary choices. So in some ways, I could see how the public conversation and the media is covering a lot of the drinking water issues, but there's also very strong institutional groups that are talking about those other topics. And what I see our role in Iowa Environmental Council's role is we totally agree that there needs to be this holistic approach, but we think that the drinking water and the environmental concerns need to be part of that, and we're really making sure that our work is keeping that in the conversation and keeping that as one of many things to consider when you're trying to minimize cancer risk in Iowa.
Kind of like fulfilling a niche.
Yeah, I think fulfilling a niche, because if you look at what a lot of elected officials talk about, they don't necessarily bring up the environmental risk factors, at least some of them. They talk about some of these other topics, which are all important, but it needs to be something where every potential risk factor is being talked about.
Mm-hmm. Do you feel there's other entities other than you and Iowa Environmental Council doing that big environmental push?
There are great researchers at University of Iowa who are doing wonderful work on this topic, and we have great researchers at Drake. And all around the country, Center for a Livable Future has some really excellent researchers who look at kind of acceptable levels of risk from different environmental pollutants. So, there's definitely a strong scientific community, and there are lots of groups in Iowa that talk about the environmental impact, whether it's Food and Water Watch or Iowa CCI, or one of our great partners has been Iowa Farmers Union, and they went on the listening tour. They joined us as partnering on the listening tour, and they're very concerned about the risk factors for farmers specifically. So, there are quite a lot of groups that are doing it. I do feel like, to some extent, the project with us and Iowa Environmental Council has really helped to kind of consolidate a focus on the risk factors. And so I feel like we're playing a valuable role in keeping that, in the conversation. But definitely a lot of groups doing really valuable work.
So a lot of the conversation around farmers is difficult. And I'm sure you've heard that, we don't want to attack farmers for certain things when we're having these conversations, and farmers have some of the highest exposure to some of these chemicals at the same time. Mm-hmm. Now, overall, cancer folks told me that farmers have lower levels of cancer, but certain cancers have a higher impact on farm communities. Mm-hmm. So how are you talking and thinking about that challenge where in Iowa we have a big farming industry, and farmers are at risk, but at the same time, I mean, are kind of contributing to the problem of nitrate in water.
Yeah. I mean, I think of it all in terms of the system that we've set up. So I think farmers are really smart and they're very resourceful and they are responsive to the regulations that are put in place and the incentives that are put in place. And right now we have a set of incentives that basically encourages people to plant every square inch of cropland that they possibly can and to use heavy amounts of synthetic fertilizers and manures and pesticides. And so we have a system that basically incentivizes the way that the current practices are being done. But if we had different policies in place, that would encourage other types of behavior and maybe setting aside more land as a natural filtration system before stuff runs off the field into the waterways. So to me, it's really all comes down to these policy choices that are not coming directly from farmers, but are coming from elected officials and from the groups that have the most influence on them. And I would say that there are very powerful industry groups that are definitely resistant to change, but I don't feel like those groups really represent the average farmer. And that's why we're really happy to work with the Iowa Farmers Union, because I think they do a great job of really listening to many different farmers and not just pushing for the things that are most exciting for some of the bigger trade organizations or industry groups that are really see this as, you know, a business and maybe don't always prioritize other social values, whereas Iowa Farmers Union cares a lot about the well-being of farmers, of course, but they also think that public health is something that needs to be part of the conversation and environmental concerns need to be part of the conversation. So yeah, so I think really I don't put the onus on any individual farmers. I think it's just the way that the policy has been shaped right now has been to kind of maximize profits for certain industries, but that ultimately should be balanced with other concerns like protecting public health. And so all we're trying to do is make sure that public health is part of this balancing equation when people are setting policy.
Yes, we talked about some of the stuff that happened this summer. Do you feel that's caused a significant shift in the way that you're reaching out, or was this something you were kind of doing beforehand and the public perception just rose as you were already doing all this work on water quality and cancer and such?
I think it's been a shift. I mean, we were working on the cancer project beforehand, but there's just so much energy around talking about water quality right now in central Iowa and other places that it's made us want to do more specifically on water quality. And so a few of the things that we've been doing as a result, Iowa Environmental Council developed a really nice toolkit for people to show that CISRA presentation in their own communities and have it be a toolkit that leads to action and engagement. We're also having a town hall meeting this Saturday with a couple other groups, so Progress Iowa, Iowa CCI, and Food and Water Watch, and that again is all focused on people are saying, we know the information, we know what's happening with the water, but we want to do something about it now. And so this town hall is going to be focused on giving people an opportunity to find ways of taking productive steps to try to improve the water quality situation in Iowa. And so I guess in general, you know, I have been blown away by how much interest there's been in this topic, both among people in Iowa, but also nationally. You know, there are people who are paying attention to Iowa and saying, wow, what's going on there? You know, there's something that is really important to be paying attention to. And so, yeah, we definitely are focusing a lot on this issue. And I think because of the niche that the Harkin Institute plays, I feel like we can be, you know, a helpful voice in this conversation by being grounded at a great academic institution and also having that policy focus and being free to just report what the science says and make recommendations based on that.
Has that national spotlight helped you? Does it feel more like, hey, we're willing to rally the troops for you, or does it feel more like, oh my gosh, like, look at how bad it is? Because I feel there can be a big difference in the kind of sensationalist, like, oh my gosh, Iowa is so bad, as opposed to we should be ready to support Iowa. And I bet you're connected with some national funding or organizations. Has that support increased, or does it feel just like more pressure?
Yeah, I think support from national organizations has increased, but I think it's really because they recognize the importance of Iowa for agriculture in general and the role that Iowa plays in the agricultural system. And so they understand that what's happening here has relevance for a lot of other dimensions of the agricultural industry. And so just to give one example, the Washington Post published a story a few weeks ago now that pointed out that among the top 6 corn-producing states, they all had an increased cancer level among people under the age of 45. So Iowa's kind of the big flashing warning beacon, but those same issues that are happening here are also relevant for the other 5 top corn-producing states in the country. And I think also Iowa represents in some ways the kind of pinnacle of an agricultural system that is very much designed to focus on profit and to not always prioritize other societal values. And so I think people care about it for that reason, because it's something that is really reflective of a way of thinking about agriculture that I think doesn't reflect necessarily the values of the average person who think of agriculture more in these kind of old-fashioned terms of big open fields and animals grazing on the land and kind of, and it's a little bit different from how it's being practiced now. And so people care about it because they want there to be a little bit more balance. But then, it was a really good question, because I think the other side of this is that definitely, I don't know if you had this experience, but I keep hearing from people that when their kids grow up, they want to leave Iowa, and there's people who are worried about moving here because of Iowa's high cancer rates. And so it is something where, that risk factor is high enough now where people talk about it a lot, to the point where it does raise concerns for people about, do they want to live in Iowa or not? And probably that's not like a fully rational response. If you balance all the pluses and minuses, like that's just one consideration among many, but it is something that's impacting our state in a really serious way. And so even if you're just concerned about the inflow and outflow of people to Iowa and economic concerns, I think our public health issues have reached a point where they're big enough that they're impacting whether people want to live here or not. And that, I would hope, would be concerning for a lot of decision makers and public officials.
Mm-hmm. You mentioned we have that second highest cancer rate. Do you think Iowa's public policy right now reflects that we have that rate, or is it still catching up?
I think it's still catching up. I know, $1 million was given to study cancer last legislative session. I think a lot of people asked for a lot more than that and thought that was kind of just a drop in the bucket. So, and that's just one portion of it. I think there's a lot of practical steps that we can be taking right now to try to minimize risk factors, and that's going to be part of what comes out in this report that we're working on with Iowa Environmental Council. So I really think that it's the early stages, and from the people I talk to, there's definitely a feeling like there's not enough being done currently, and that a lot of elected officials aren't prioritizing this issue enough, given how concerned people are about it. And so that's why I would say it's really early stages. And the energy that I see in the public has not yet been matched by the energy I would see in some of the bigger institutions and the state government.
You talked about Iowa being one of the Corn Belt states and having this really high corn production. Why corn specifically when we talk about cancer?
Yeah, I think corn is just a crop that lends itself really well to heavy application of pesticides and fertilizers. And it's also part of this bigger system where Iowa has the system of corn and soybeans and many, many concentrated animal feeding operations. And a lot of the corn that's being grown goes to either ethanol or goes to animal feed, and some of the soy also goes to animal feed. And so it's part of this bigger complex of things that all play a role in it being a heavily industrialized system. And so the relationship between corn and concentrated animal feeding operations is that, Iowa has by far the most concentrated animal feeding operations for pigs in the country. We produce the most eggs, and I guess especially when it comes to pigs, there's a huge amount of manure that is generated, and there needs to be somewhere to put that manure. And so Iowa, I saw the statistic recently, 109 billion pounds of animal waste is generated in Iowa every year. And so we need to be able to put that manure somewhere if we have all that animal waste. And so the easiest place to put it is in the fields surrounding where those concentrated animal feeding operations are. And so because there's so much manure being produced, it gets spread out in quite a lot of places. And I was referencing earlier the manure management plans. In theory, there would only be one concentrated animal feeding operation putting their manure on a particular field. But because we have so many concentrated animal feeding operations and they all need to be able to spread out their manure, there are cases where the same field will get many, many different applications of manure in the same year. And that is part of the reason, and the manure has nitrogen in it, and that's part of the reason why there's so much nitrogen getting washed into our rivers. So it's all kind of part of this bigger system where I think, both it's the case that corn is a crop that kind of lends itself well to heavy application of pesticides and fertilizers, but it's also very connected to concentrated animal feeding operations in Iowa, which are dramatically bigger than in other states, and those also produce they're also responsible for a lot of the nitrates in our water.
We talked about some of the policy stuff with fertilizer. How would policy work to transform our concentrated animal feeding operations into something that's putting less nitrate in the water? I mean, you can't exactly, make a pig stop pooping. So, what would that look like?
Yeah, I mean, those are tough questions. I mean, I think part of it is just asking the question of, do we really need as many of those operations as we have? And it's not like they're remaining stagnant. It's still growing every year. We're still putting in more concentrated animal feeding operations. And so one thing that comes up with that is that people used to have the ability to sort of make their own decisions within their own local area about, do we really want this coming in or not? And that actually got taken away through legislation a while ago. And so there's no local control. But one thing that might be helpful in that regard was just restoring the ability of individual counties or individual communities to stop a concentrated animal feeding operation from coming in if they feel like it doesn't fit with their values. So I think that's one thing that is important. And then I also think it's important to point out that they're not just here by accident. It's really the fact that all of our policies are designed in a way that totally incentivize the building of more of these concentrated animal feeding operations, and that being the most kind of economically efficient thing for farmers to do because of the policies, not just on its own, but because we're offering crop insurance that's used to produce cheap animal feed that then goes to these operations, and giving them tax breaks, and doing a lot of other things that make it financially very lucrative to have those feeding operations. So I think if we have policies that are more reflective of a variety of societal values and not just pushing everyone to the corn, soybeans, concentrated animal feeding operation model, that economics in and of itself will help shift the number of those that it makes sense to have in Iowa and surrounding states, and will make it a better match, I think, our values as a society.